unresolved trauma to be resolved before they leave and before they're discharged. And you know, we send them off to an aftercare program, because for us, we can work on the addiction, which we do in most groups and in individual therapy. But if we do not pay attention to their trauma and deal with that, then those emotions that contributed to their addiction will still remain suppressed inside them. And we're encouraging them by building their self-esteem, their self-worth, their confidence in themselves, and recognizing the progress each and every day that they make. And so that's what our approach looks like. It's dealing with not just the alcoholism in this hypothetical client, but the trauma, the PTSD, and all the other life experiences that contributed to the client's alcoholism. Does that make sense?
That's great. Thank you. I appreciate that. And I apologize. I started recording just a little bit late. So I'll ask questions throughout, because I'm always, you know, fascinated about the process and what's going to happen once the patient gets there. So you'll probably talk more about this as you're going in, but like you say, innovative treatment models. So are you guys using different modalities that are specific to success rates that you've seen with specific diagnoses?
Great question. And yes,
sorry.
the answer is no, thank you. It's a wonderful question. Yes, so we use your traditional CBT, cognitive behavioral therapy. We use DBT, which is sort of like a sister to CBT. And that's really important when we have clients that come in here with BPD, borderline personality disorder, or bipolar. That's where DBT was founded. However, evidence suggests today that DBT is also useful to deal with addiction. And so we use that. We use EMDR, which is wonderful to deal with trauma. We used a solution-focused approach. We used a narrative mapping. We use any modalities that the client can benefit from, we can utilize here with our therapists on staff.
Nice. Thank you.
You're welcome. So I'll move to the next slide. So this is a beautiful environment designed by Janelle on purpose. It's an intimate, as I mentioned earlier, 6-bed detox residential. Clients want to come here and feel heard. With 6 beds, we can manage that and exceed their expectation. Most treatment centers have significantly more than 6 beds. And for us, it's all about, as I mentioned earlier, an individualized plan. Limiting the clients to 6 allows us to give them that client-centered approach and be hands-on 24/7 for them. So we have staff around the clock that's here, behavioral techs. You know, I'm here, Janelle's here, our clinical supervisor director's here, you know, our nurses here from time to time. So we have a staff available anytime a client wants to be heard. And that's because we limit the clients that we bring in here to the 6 beds. In addition to our environment being very positive, it's like, you know, with respect to, as this slide indicates, their moods, you know, we have a lot of holistic programming here, which you'll see in another slide, but just to address it now, we believe in, you know, a holistic approach, you know, as well as a 12-step approach when it comes to substance use. But we have sound bath, we have Reiki, we have breath work, we have yoga. This helps to build the client's self-care part of their recovery. And this also helps them to become mindful and be present and not catastrophize and worry about tomorrow or 6 months from now. And this is evidence-based literature to support the importance of mindfulness and self-care as integrated into their overall plan. One of the things we're responsible for and we take a lot of pride in is their aftercare planning. You know, yes, God willing, they'll leave here with resolved trauma, as we discussed before, but what's their next step? Our hope is that their next step after 30, 45 days here is not to go back to their living environment. We encourage them to continue an aftercare plan that includes a sober living environment with either a PHP and an intensive outpatient program. And we're very hands-on. We'll take them on a tour to see multiple places. You know, we don't have any equity interest in third-party programs, but we know which programs will work best for the client based on our experience. Any questions at this time before I move on?
No. Oh, sorry. I do have a question. Um, so in terms of, you talk about, making it a focus to resolve trauma. And so give me some ideas how you do that. I mean, you're talking about all kinds of different modalities and whatnot, but how do you feel that you're most successful in resolving people's trauma? And I know that that's a real hard question, but do the best to explain that to me.
Sure. So as you probably know, addiction can contribute to impaired family dynamics, right?
Mhm.
Most people that come here have either, disappointed or hurt their loved ones, their loved ones lost trust in them. And so, family trauma is something that many clients come in here and have experienced. And so we encourage family therapy. We encourage couples therapy because again, we don't want them to leave without learning assertive communication skills, how to talk to the loved ones, how to no longer be defensive when their family is they're earning back the trust of their loved ones and family, how to communicate with them, how to listen, how to accept responsibility for your poor choices, how to not make excuses and play the victim role. So by doing this, teaching them assertive communication skills and the importance of earning back trust, which is there's no specific timeline that suggests it's all individualized, how long that might take, but we don't have them create an expectation that the dynamics will be repaired the moment they leave here. It may take 3 months, it may take 3 years, but we help them to understand that having the courage to be vulnerable and to acknowledge their part that played a role in the family dynamics will only enhance the possibility of reuniting and improving their relationships. And so these different modalities, apply to not just family dynamics. Some may not. But if you're coming here with, some females, some women have come here with, rape and molestation in their past, EMDR, and it's suppressed. They've ignored the feelings and connecting with their emotions. So we teach them the mind and body connection. When your body is telling you something, understand it, connect with it, feel it, learn how to respond with good coping skills to those emotions. But EMDR is very useful for women like that and for other reasons. Does that help?
Yeah, yes, thank you.
Thank you for asking that. It's a great question. Shall I move on to the next slide? Okay, so this is a little snapshot of our beautiful home. As I said, it's a detox and residential treatment located here in Encino. And why is that important? That was designed specifically by Janelle. Strategy was many of our, if you will, other luxury rehabs are located in Malibu. But what we wanted, and there's a lot of paparazzi with high net worth clients or other clients, we want to keep a place that's discreet and that's beautiful and that they can feel safe in. And so that's why we chose Encino. I'll move to the next slide. You can feel free to play this, or here, I'll play this for you. Okay, we're going to go to the next slide. Can you hear me?
Yeah, we can hear you. It kind of froze on the picture. Looks beautiful.
I wish I could take the credit, but I have to give that credit to Janelle. We're trying to get to the next slide here. Okay, so our pre-admission process, can you see that slide? This is specific to you. So upon receiving notification through RecoverWell, indicating that your patient is interested in our detox residential care, we'll review the information that you provide. And we'll respond promptly. And once that step is complete, we'll initiate our pre-admission process, which is very thorough, relative to the client's substance use, their current medication, any psychiatric diagnoses we can do through an assessment if we otherwise don't have that information from RecoverWell, to ensure that we're a right fit for the patient. And then if it's a go, we'll arrange transportation if necessary and begin the overall admission process upon the client's arrival. Any questions?
No,
Okay.
I do have a question, and I bet you that if I wait, that question would be answered, but I'm going to ask anyway. So are you a medical detox?
So we have medical assisted treatment. We have a nurse here and we have a medical doctor as well. So within 24 hours of admission, a client must see the nurse and must see the doctor. Within 72 hours after that, the clients will see a psychiatrist and look at the mental health component of it. Does that address your question?
Yes, it sure does. Thank you.
You're welcome. So as you can see here, once the client arrives, they're closely monitored. We take them to the nursing station. We complete the urine drug screen, because sometimes clients can say they're doing opioids, cocaine, meth, and the only thing that shows up on the urine drug screen is meth, right? Because clients tend to dramatize what they're using. And so it's important for us to do this first step to really understand what we're treating. And then we let our medical and management team know the results of the drug screen. Once we have that, we review their symptoms with the medical team, and then medications by the doctor are ordered and administered. Our nurse will be on site, as mentioned, to evaluate that as well, in a collaborative effort with the doctor and management. Our clinical team will shortly thereafter begin, likely within 24 hours, individualized treatment planning and assess the overall admissions. Questions? Okay. So this is like a little fun picture we put in here. Some of our staff and the clients, of course, have the happy face next to them. I'll move on to the next slide.
This is what we provide.
So we provide detox residential treatment, as mentioned earlier, for dual diagnosis, substance use, and co-occurring mental health. And we believe in medication-assisted treatment. Here's some of those modalities we talked about earlier: DBT, CBT. We didn't mention ACT, but we did mention EMDR. Our holistic practices we mentioned as well, to include breath work and massage therapy. We also believe in taking our clients off-site for 12-step meetings or alternative type recovery meetings, which could include refuge recovery or smart recovery, or wherever they want. We're open to take them if that's what's going to improve and their commitment to recovery. We also do a lot of H&I panels here. We have a gym, a beautiful state-of-the-art gym. We have the pool, as you saw in the video, and we have a private chef and a housekeeper here to maintain cleanliness and that environment that we want the clients to feel comfortable. We also have a nutritionist that comes once a week. And so we really feel that we're kind of covering all the areas and more that a client, to give the client the best chance to succeed and to maintain a sustainable recovery once they leave. Questions?
I do have another question.
Yes.
So you talk about the different kinds of meetings that you offer, and I'm just wondering, is it always a choice what meeting they would want to go to, or it's?
Yes, great question.
I was wondering how that would work.
Sure. So most nights in the evening, after they've done their individual therapy or our groups in-house that they're required to attend, we encourage the clients by saying, we're going to go to a meeting tonight. This is the meeting. I'm making this up. It's an AA speaker meeting. Would you like to go to that meeting, or would you like to go to an NA meeting today? And then collectively, we'll take the unanimous vote, and clients can accept that they were outvoted, or, one day they'll be outvoted, the next day they won't. But it's a collaborative approach between staff and clients.
And do they have the option to not go if they decide they don't want to go, or is it like,
Yes.
no? Okay.
Yes, they're not, we don't force them to go. We
Okay.
just encourage it.
Okay.
Thank you for that question.
Thank you.
So I won't
We
read
got
all the.
another question from our Denise, and she may, a statement, just our Denise said it would be wonderful if our patients that are county funded could benefit from such beautiful services. Totally agree. I wish that was the case, because the difference between the Medi-Cal services and the luxury services is huge.
Yeah,
But
thank you for saying that. I don't mean to interrupt, but I just want you to know that we have from time to time, in a special case, Janelle has agreed to scholarship a patient. So yes, because we wish that Medi-Cal, open their doors to, private treatment facilities, but that's why we do believe in scholarships when applicable.
so that's a good point. So when you say scholarship, would that be a full scholarship to a Medi-Cal patient, or scholarship to cover the cost of co-pays and deductibles?
We would cover the entire cost of their treatment
Okay.
as a scholarship. And so just, I don't know if you're aware, but the insurance we take is generally a PPO. We don't accept HMOs or Medi-Cal. When we get the PPO, one of the things we evaluate is the deductibles and out of pocket. But we really the scholarshiping is really important. We really believe in giving back. Any questions, or are you enjoying the testimonials?
Just checking out the testimonials myself.
I mean, I wanted to put the 100+ that we have, but Janelle asked to limit it to 6.
I don't think we'd be able to see all those. This looks really nice.
How long have you been open?
Over 2 years.
Oh, wonderful.
I have a question.
Yes.
So my name is Altus Walker. I'm the substance use navigator here at St. Bernardine Medical Center. So my question is, you mentioned scholarships, and not to play devil's advocate or anything, but we've been hearing that, and then when we reach out to these different places, our patients are not being able to benefit from any of these opportunities that's supposed to be scholarships. And I know it's a timing thing, but my question for you is, how often do you guys actually allow a scholarship to occur?
I would say on average about 3 times a year.
Okay, good to know. Thank you.
Great question. Thank you. And I wish we could do more, and perhaps we will as we expand. So we're planning on expanding to a couple more homes with the same type of environment. Any other questions? We love questions. We want questions. And by the way, thank you again for allowing us to work with you.
Can I ask you what part you play in actually the day-to-day there? Are you on site or?
I'm on site 7 days a week.
Okay.
For about 10 hours average a day, Monday through Friday, and as needed Saturday and Sunday. For example, I needed to come here last night for a couple hours. Clients were struggling and they wanted to talk. I live 10 minutes away by design because my commitment is to be here for the clients, and that's why I chose to work here, because Janelle and I have the same philosophy that clients come first.
All right, thank you.
You're welcome.
So once the person is settled into your program, they've been there for a couple of days, they've done the labs, the assessments. What does a typical day look like? What time does the day start? And what time does the treatment end? Is this like, they're in treatment? Because, 30 to 45 days is a long time, especially with patients who have PTSD or any like extreme, um, mental health, in addition to their substance use. What is that? I mean, how do you pack it up? You must pack it all in there. What does it look like?
Great question. So I will say that with respect to the PTSD hypothetical, that's for me a reason why clients should stay a minimum of 30 days, because as mentioned to start this meeting, it's really important that clients leave here with all their unresolved, stressors, diagnoses, and trauma resolved. That being said, our curriculum is sort of like a dual curriculum. When they come here and they admit to detox, they're not required to do the programming, which I'll get to in a moment, but they're up by 8:30 taking their medication, following the frequency of the doctor's orders. We're managing, we're using, medical assisted treatment for that. We check on them every 15 minutes. So our rounds are 15 minutes, 24 hours a day. We're collaborating with them. We're asking them how they're feeling. What can we do to support you? We're encouraging them to advocate for themselves, because we're not mind readers, and they really appreciate that. Now, once they're off of detox, they begin the RTC, or residential portion of treatment. At that time, they're required to also get up on or before 8:30, eat breakfast, take their medication if needed, and then they attend about 4 to 5 groups per day, as well as individual therapy Monday through Sunday. And individual therapy is usually 2 to 3 sessions a week, but if needed more, we're happy to assist the client based on his or her needs.
Thanks.
And the weekends, we also take them, for an outing if necessary. Again, just to get them out of this house. We don't want them to feel restricted. We want them to understand that we'll take them to, let's say, a museum, and we ask them where they'd like to go. Or we'll take them to the beach and we'll practice mindfulness on the sand, and use grounding techniques. So we really believe in a strong curriculum that really occupies most of their day. On Sunday, we also have a couple groups as well. So it's very thorough. Their family comes to visit on Sundays, or anybody that they want. It has to be pre-approved between the hours of 1 p.m. to 6 p.m. We have made exceptions to that for other clients.
Do you talk about how it works when folks have insurance? How, like, what insurances can you work with? And how does that work?
Yeah, we work with most PPOs, and we'll get a quick, within a few hours, we'll receive their verification of benefits. Because if a client has, making this up, $20,000 out of pocket, that's probably not a client for us unless the client can pay for that. And we don't want the client to come out of pocket. So we're looking for low deductibles, low out of pocket PPO policies that we can absorb their $1,500 maximum out of pocket. And it's sort of like a pseudo way of scholarshiping those clients.
Good. That's great. Do you have experience, like what types of policies tend to work a little bit better for you, so we have a general idea, or is it always individual, case by case?
It's case by case.
Okay. All right. Well, I don't have any more questions. Does anyone else have questions? Okay. All right. I see folks sort of like jumping in and out. I'm gonna do the raffle. Sorry. Losing my words. I'm gonna do the raffle, and then we'll send out this video to everyone later, hopefully later today. I don't have Aya with me this week, so it might be a little bit slow for me to get back to everybody. And if Sylvia's on the call, please text me where you want your gift card from last week to go. I don't see her on here, so I'm going to share my screen, and I put all the names on here earlier of the people who had registered, but I still not everyone is on here. So, I know Dana. Oh, Wendy, is Wendy on here? I'm gonna go on until we get somebody who's on here. No, I'm gonna take, I know Christy and Wendy are not on here. Who do we have on here right now? Because we're doing two, right? We got Amanda, Dana, Tiffany. Okay. So I'm gonna send a gift card to all three of you. Rather than make you guys wait through this whole thing. So Amanda, Dana, and Tiffany, can you guys please send me where you want the gift card to go to, either your cell phone or your email. My phone number is 818-522-3654. Amanda said, great presentation. Thank you. Everybody send me 818-522-3654. Text me where you want your gift card to go. And I will also send everybody out this presentation. Please spread the word about Altus Rehab. And thank you so much for sharing this information with us and letting us know how we can get our patients in to your facility. I really appreciate it.
Thank you for your kind words, and thank you for allowing us to present with you today.
Of course, of course. So happy. And hopefully you'll do another presentation soon so that we can get the word out to more people.
Much appreciated anytime. Thank you and have a beautiful day.
Care.
Thank
You
you.
too.
Bye.
Thank you so much.
Take care. Bye.